Good morning. Welcome and thank you for being with us bright and early on Monday morning. We're excited to have you with us. My name is Amy Robbins and I'm the Senior Director of Policy for PHI. And on behalf of PHI and the National Alliance for Caregiving, I want to welcome you to the Together in Care, Empowering Direct Care Workers and Family Caregivers to Meet Growing Demand for Care webinar. Before I hand it off for introductory remarks, I wanted to make a couple of housekeeping notes. This webinar is being recorded and it will be shared with those who registered, and it will also be posted to our website, and information on that will be provided at the end of the webinar. Please use the chat function to send us your questions throughout the webinar. We will have time for a Q&A at the very end of the hour, and we really want to hear from you. If we don't get to your question today, we'll also be providing contact information at the end of the webinar so that you can reach us directly. You'll note that we have ASL, American Sign Language interpretation, provided by Sorensen, and Adrian has joined us from Sorensen. Closed captioning is also available. It is an option to turn on within Zoom. If you need technical assistance with that, please use the chat function, and one of our behind the scenes support folks will help you out with that. So without further delay, I would like to turn this over to my boss, the President and CEO of PHI, Jody Sturgeon. Jody?
Thank you, Amy, and thank you to everyone who's joining us today. We are really excited to share with you the important work that PHI and NAC are doing to strengthen the relationship and lift up the critical opportunities for partnership between direct care workers and family caregivers. This work would not be possible without the vision and the support of the John A. Hartford Foundation. For as long as I've known the foundation, they've both understood and underscored the connection between direct care workers and family caregivers. Their investment in the Together in Care initiative is reflective of that and is deeply appreciated. So many thanks to our colleagues from the John A. Hartford Foundation who are here today. When we saw the steady stream of registrations for this webinar, literally 570 people in just 2 weeks, it wasn't surprising. But what was striking in particular was the diversity of perspectives that are represented on this webinar today. From consumers and family caregivers, direct care workers and providers, to advocates, policymakers, researchers, and representatives from state and local agencies, and more. Each of us on this webinar today has a role to play in shaping our nation's care system. And I know all of us are here because we want to make a difference in doing that. The need for care and support leaves one vulnerable and often isolated. Direct care workers are a lifeline for people and families. And at the same time, they're under-recognized, undercompensated, undervalued overall for the essential role that they play in the lives of millions of Americans. As our country ages and we live longer, the demand for paid caregiving is rising rapidly, and the strain on families trying to support their loved ones is increasing as well. Investing in the partnership between direct care workers and family caregivers will improve the quality of direct care jobs, increasing and attracting more workers to the field and also helping them to stay in those jobs. But it'll also provide critical support to family caregivers and ensure that older adults and people with disabilities receive the care and support that recognizes their individual needs and preferences. It's really exciting to me today to have so many of you on this webinar, which can be a profound signal to older adults, to people with disabilities, to family caregivers and direct care workers alike. We're saying by being here, you're not alone, and we're all together in care. And I would just close by saying this is a really critical time. We're operating in a volatile political climate and a sense of social unease. Concretely, the gains that we've made, and all of us collectively have worked towards that, and investing in our care systems are at risk. That makes it even more important to come together, such as PHI, NAC, and our colleagues and supporters at John A. Hartford Foundation have done here. we must continue to push to advance policies, to make choices in practice, and to strengthen the evidence base for the powerful impact that direct care workers and family caregivers can have on those millions of Americans. That has been our North Star in this initiative so far, and it will continue to be going forward. And I just again want to thank you all for joining us in that and turn it back over to Amy.
Thank you, Jody. I will now have the great pleasure of turning it over to Jason Resendez, the President and CEO of the National Alliance for Caregiving. Jason?
Wonderful. Thank you so much, Amy and Jody, and for all of you for joining us for this essential conversation. America's 53 million family caregivers are the cornerstone of quality care for older adults, for loved ones navigating complex care, and for people living with disabilities. Their dedication and efforts are vital for sustaining our healthcare system, and most importantly, for building strong families and communities. And in millions of families, this care wouldn't be possible without the support of direct care workers. That's why the Together in Care partnership with PHI is so important to NAC. This collaboration allows us to leverage our combined expertise to better support, empower, and bring visibility to both family caregivers and direct care workers. Together, they form a critical partnership that enables higher quality care and support for older adults. And as Amy recognized, and Jody in her remarks, we're at a critical juncture in caregiving. The landscape of care is changing rapidly, and there's a growing recognition of the need to empower family caregivers alongside direct care workers. This moment presents a unique opportunity to reshape and accelerate our efforts to value care and the people who provide it. And that wouldn't be possible without the support of the John A. Hartford Foundation. We extend our sincere gratitude to the foundation, to Ronnie and the entire team for their invaluable support of this initiative. Their commitment enables us to champion the change that we need to value family caregivers and direct care workers. So thank you for joining us in this effort. Each of us has a crucial role to play in advancing this important work and creating a more supportive environment for family caregivers and direct care workers. Remember, we're all together in care. Thanks, and back to you, Amy.
Thanks so much, Jason. And now we have an opportunity to hear from our funder, the John A. Hartford Foundation. Ronnie Schneider, the VP of Programs, is here with us. Good morning, Ronnie. Thank you for being here.
Thanks, Amy. I really appreciate it. And many thanks to Jody and to Jason as well. A couple of words about our foundation. We are a nonpartisan philanthropy. We're based in New York City, but we operate all across the country. And we are super proud to support PHI and NAC and this Together in Care initiative, which is working so importantly to empower direct care workers and family caregivers by building policy support for their critical yet too often unrecognized relationship. This initiative fits in with our mission to improve the care of older adults and our three priority areas. So they are building age-friendly health systems, supporting family caregivers, which is central to what we're talking about here, and improving serious illness and end-of-life care. And you can hear how those three areas fit together. So we're really excited for you to learn more about this Together in Care initiative and its recently released recommendations for policy action. That's where it's at. The direct care worker and family caregiver dyad is a focus area for our foundation that we think deserves much more attention across the board, from policymakers at the federal and state level, as well as from health systems and in our programs and our services. Why is that? Because we think a lot about the fact that our nation is aging. And as our nation ages, more and more people, you and I, and all of our families are going to need long-term services and supports. And it probably doesn't need to be said to this audience that family caregivers and direct care workers are the backbone of that long-term care, especially now with the fragmented system that we all operate within. So when there's a strong relationship and a solid partnership between family caregivers and direct care workers, we all can achieve better outcomes. Unfortunately, Too often, we silo our policies and programs rather than look for the integrated support that both paid and unpaid caregivers need. So this idea is embedded in the RAISE national strategy to support family caregivers, which our foundation has strongly stepped in and supported. And that's why the John A. Hartford Foundation wanted to bring together PHI and NAC through a grant that we approved in March a year ago. So these two really outstanding national organizations have renowned expertise in direct care workforce, that's PHI, and family caregiving, that's NAC, National Alliance for Caregivers, and they're primed to bring other partners into this cross-sector thinking so that we can all remove those silos from the care conversation. Our grant resulted in this Together in Care initiative, which you'll hear more about today. We hope you'll get more and more engaged in, and it's going to help all of us together to bring visibility and ultimately a new vocabulary to the relationships and to the policies that impact both. So I can't stress enough from our perspective the importance of advancing policy in this space now. The Care Dyad is doing care work every day, and the needs of older people, people with disabilities, and others who require care don't get a day off. So we recognize what a challenging time this is given state budgets, given political climates, but honestly, we owe it to this essential dyad to advance policy solutions that support and ultimately value their very intertwined work. So with that, I'm going to turn it back to the agenda to hear what this looks like and how you can get involved. We really look forward to hearing from our speakers and from each of you in what I know is going to be a really important and engaging conversation. Thank you.
Thanks so much, Ronnie. Tony Gingerelli is here from the National Alliance for Caregiving, and she's going to provide an overview of our initiative Together in Care before we dive into our issue brief and the recommendations included in that. So Tony, take it away.
Great. Thank you so much, Amy. And thank you again to the John A. Hartford Foundation for funding this initiative and your continued investment in this work. Next slide, please. As mentioned earlier, the Direct Care Worker and Family Caregiver Initiative, otherwise known as Together in Care, is a multi-year collaborative between PHI and the National Alliance for Caregiving. And it serves as a bold step towards strengthening the relationship between these essential caregivers. At the end of June, Together in Care launched its first ever issue brief. The brief draws attention to the emergent mutually beneficial opportunities to change the paradigm for direct care workers and family caregivers, and highlights the need for additional research and increased evidence that can inform critical policy and practice-based interventions. Next slide, please. The brief draws insights from direct care workers, family caregivers, and recognized leaders in caregiving, home care, aging and disability services, Medicare and Medicaid, and workforce development. We gathered these perspectives through a September 2023 national convening with more than 10 experts, 13 additional individual subject matter interviews, and a robust literature review. During this webinar, you will learn about just some of our many policy recommendations to further strengthen the relationship between direct care workers, family caregivers, and care recipients. Next slide, please. But before we dive into these recommendations, we will hear firsthand from an incredible caregiver and advocate about the challenges she faces in her role and where she sees opportunity to strengthen the partnership between direct care workers and family caregivers. So with that, I'm happy to hand the mic over to Debbie Harris, a family caregiver from Ohio. Off to you.
Good morning, and thank you so much, Tony. My name is Debbie Harris, and I'm actually from Minnesota, where it is storming right now. Fortunately, we're not susceptible to Hurricane Debbie, where many of you are, so I hope everybody stays safe. Our family, we are really in the trenches of care for our son Joshua, and Joshua is 31 years old. He was born prematurely and had a grade 4 brain hemorrhage at birth. And subsequent to that, he has a number of conditions related to his brain hemorrhage. So he has cerebral palsy, spastic quadriplegia. He's non-ambulatory, has developmental disabilities. He has a history of very significant respiratory infection. It's difficult for him to swallow and handle his secretions. So his primary airway is a trach tube. And in order to help enhance his breathing and make him comfortable, he uses a ventilator, not full time, but about 8 hours a day. Josh receives assistance with coughing through a cough assist machine. He's on 24-hour oximetry, so we can monitor how much oxygen is saturating his blood. And Josh, because of neurological impairment, is not able to really control his vital signs very well. So every now and then he'll kind of throw us all a punch, and sometimes his heart rate will be 39, and in the same day it can be 198. So we do have our work cut out for us here, but we feel grateful. We were told when Josh was initially set to come home from the NICU and transitional care that he would live only for 2 months. And then they revised that and said it would only be 2 weeks. So since then, no one has brought it up. And now he's 31 years old. So we live with gratefulness. A typical day for us is, I guess I would define as not typical. So we do have caregivers in our home. Josh right now has a staff of 2 daytime nurses. He receives licensed nursing care through our military insurance. And he has a nurse who comes in to cover night shifts for him. When we don't have those hours filled, however, my husband fills in night shifts, and our other son who lives with us, we have 3 sons, and they have been amazing in Josh's care journey. And we are really grateful because as I was thinking, I was writing, I do a lot of writing in narrative medicine, and I kind of chronicle our story and talk about some of the challenges on our journey, as well as those aspects of it that are really joyful. And as I was thinking about our journey last night and writing about it and thinking about the early days, early on, there wasn't Josh was ordered for 24/7 hour care, which he still has. Someone has to be awake 24 hours a day, 7 days a week, to suction, reposition, monitor vitals, administer about, I'd say Josh has about 4 pages of medications that he receives scheduled about three times a day, as well as needed medications to mitigate any conditions that come up during the day. And so there's no downtime. And I was thinking about the early days and how there wasn't a lot of regulation in home care nursing. Families didn't have the capability to be paid as caregivers. My husband and I, when we started this, and it was a surprise as Josh was born prematurely, both worked full time, and we counted on those 2 incomes. We would have to decide who is going to call in and take off work when a nurse from an agency didn't show up. And it got to be pretty problematic, as you can imagine, by our employers. And so it compromised our work, it compromised our income. We were definitely way behind our peers when it came to just growing as a family, financially, socially, and everything else. It's a very isolating experience. And I was thinking about those days and how agencies, because the reimbursement was either non-existent or not very much, did not engage in orientation or training for people who came into our home to care for Josh. And on several occasions, he was harmed either through inappropriate care, neglect, or actual harm, because we had no voice in who would be coming to our home. And very often, a couple of times critically, where we didn't think that he would live through it. And so at some point along the way, we promised Joshua that whatever happened, no matter the resources available to us, if we didn't have a say in who would be caring for him, then we wouldn't put him in an unsafe situation, and we would do it ourselves. And so for many years, we ended up having to do that. We, about a little over 10 years ago, got access to a federal home and community based services waiver. Josh is on a waiver called community alternative care. It's for people with high medical needs and or disabilities. And Josh qualified for that. We used it in a traditional sense to cover nursing care before our insurance actually covered it. And then we found out that we could use it in a more flexible way, in a creative way, where the monies from that waiver could be set aside for an individualized budget for Joshua that he had a voice over, and we as guardians, as parents, as advocates, had a say in what line items went into that budget. And this allowed Josh the security of being able to stay at home, to have caregivers who were treating him like a person with dignity and respect, were aware of the cultural differences perhaps in our family and respective of those. And it changed the dynamic in our home a lot. Typically, you want your home to be your safe place and the place where you go to kind of get away from the stresses of kind of this massive medical machine that we rely greatly upon, and our house wasn't a safe place. But now, as I'm reflecting upon the changes since we were able to participate in this service option through Josh's waiver, it allowed us to incentivize the nurses who came into our home. Prior to that, the pay was not competitive at all with the pay that nurses could receive in facility long-term care in hospitals. And so it was very difficult to attract people. If Josh were to go into the hospital, especially as you think about like during COVID, during the pandemic, other families didn't want nurses going between homes. And so if Josh were to become sick or to become hospitalized, his nursing staff was out of work. They had to use their PTO time for that time, which wasn't a lot, and left them in a really strained financial condition. And so we were able to incentivize them by providing quarterly bonuses that helped to just enhance their pay, to help them feel financially secure. And just proud to announce that Josh's daytime nurse told me a couple of days ago that she had just completed her 9th year in his care and going into his 10th year. And his other full-time nurse is going into his 10th year as well. And we do have a full-time night nurse. And even today, because our night nurse is going on paternity leave shortly, and we need to have some help. My husband just recently had 2 heart attacks this spring, so we've set on another caregiving journey, and so hasn't been able to help out as much as he had been. I'm able to select someone and to offer her a sign-on bonus for signing on with our agency through Josh's waiver. And so we're training her in today so that she can be Josh's backup person. She's already a nurse and was a friend of mine, so I know her and trust her. And unfortunately, she lost her son 2 years ago. But she respects our situation. She respects Josh as a person. And so while we are extremely grateful for the changes that have been made, we're still afraid because, you know, as families thrive when policies and legislation and administrative operations are in our favor, but they change all the time. And even that program that Josh is on now is being redesigned, and people who do need nursing care are being asked to go back to their archaic way of receiving nursing care through straight Medicaid reimbursement, which is not enough. And in light of the critical nursing shortage, it would be devastating to Joshua. The reason being that the budgets that the one I'm talking about for Joshua in the redesign are terribly slashed and just a fraction of what they have been, and I wouldn't be able to sustain the incentives that we've been providing for the last 10 years. So we're working hard to advocate for to keep the changes in place that have really been working well. We're grateful for every day that Josh is here with us, and also just carrying on and navigating this system and its challenges. So at this time, I'm going to thank you for listening and turn it back over to Tony.
Thank you so much, Debbie, for sharing your experience and perspective. Debbie and Zolma Torres, a direct care worker from New York, also participated in our expert convening last September to help inform our final brief. So we are incredibly grateful for you taking the time out of your busy schedules to support this work. So with Debbie's remarks centering the conversation, we will dive deeper into some of our recommendations. And our recommendations are broken down into 4 key areas. The first is care integration. Second, expanding access to self-direction. Third, matching service registry options. And fourth, investing in research and evaluation. Again, in this presentation, we are highlighting just a few recommendations today. So we recommend checking out our full list of recommendations at togetherincare.org. Next slide, please. So our first set of recommendations falls under care integration. Direct care workers and family caregivers spend by far the most time with the individuals they support, as we saw in Debbie's remarks, on a day-to-day basis, and therefore have essential knowledge of their experiences and needs. However, both direct care workers and family caregivers are too often excluded from care teams and care planning, which can lead to fragmentation, miscommunication, and information gaps. Care team integration refers to the integration of family members and direct care workers into the interdisciplinary care team. Together, these essential caregivers can help inform care planning and assessment, strengthen coordination, report changes in an individual's health status or social determinants of health, and improve quality outcomes and efficiency. One recommendation we would like to highlight is through the Health Resource and Services Administration, otherwise known as HRSA. HRSA should fund additional pilot and demonstration projects, evaluating practice approaches to strengthen direct care worker, family caregiver, and consumer communication, and collaborative problem solving, and then develop policy guidance informed by the findings. Additionally, we also see opportunity in the hospital at home program as it expands and possibly becomes permanent. Congress should direct CMS to establish metrics for evaluating the experiences and impacts on family caregivers in the program. We also see an opportunity to include direct care workers in the hospital at home program model. Building off that, CMS should develop guidelines for supporting family caregivers engaged in the hospital at home, including provisions for care coordination, planning, and training in partnership with direct care workers and other healthcare providers. On the state level, states and provider employers should explore ways in which experienced direct care workers can take on advanced roles within their scope of practice to support care team integration and empower consumers and family caregivers. By providing opportunities for career growth, such practices can also support improved recruitment and retention. Some other recommendations under care integration highlighted under our full policy brief are on the topics of telehealth flexibility, health information access, increasing awareness around Medicare home health coverage parameters, expanding training for direct care workers and family caregivers, as well as others. Next slide, please. Next, we will cover access to self-direction. Self-direction, also known in some contexts as consumer direction, refers to the ability of care recipients and their legally appointed representatives to recruit, hire, train, and supervise their own direct care workers, often known as independent providers in this model. In some states, And in specific circumstances, self-direction programs allow family caregivers to become paid caregivers for family members. If family caregivers themselves do not wish to or are not permitted to serve as a paid caregiver, they can play a critical role in supporting the care recipient hiring a direct care worker. Enrollment among consumers eligible for self-direction is limited to date. Too few individuals know that this is an option. And to address this issue, CMS should provide technical assistance to states to support outreach with regard to self-direction, with a focus on expanding reach to underserved communities. Looking at the state level, states should continue to examine Medicaid program models that allow family caregivers to be paid as a means of addressing direct care worker shortages and promoting consumer choice. Self-directed models can allow beneficiaries to select and pay for direct care workers, including family caregivers, to provide personal care, especially in rural areas and those with limited provider options. In the case of paying legally responsible family caregivers, these models should ensure protection of the individual's autonomy and prioritize community integration. Additionally, state Medicaid programs should consider making training and supports available to family caregivers who take on the responsibility of providing paid care, implementing caregiver assessments to ensure caregiver needs are identified and addressed as a part of the consumer direction programs. Offering peer mentorship and access to healthcare for paid family caregivers may help offset challenges and potential burnout associated with family caregiving. States should also assess and pursue developing targeted training and support for family caregivers who take on paid roles caring for a family member, seeking pathways to long-term employment in direct care and other long-term services and support roles. In this section, our report also addresses data collection and reporting requirements, respite care options within self-direction programs, and more. With that, I'm going to pass it on to my colleague, Amy, to talk a bit about the two other recommendation categories.
Thanks so much, Tony. So our third set of recommendations focus on matching services registries. These are online portals that serve as a resource for connecting direct care workers who are seeking employment opportunities and consumers who are seeking support or care. You heard from Debbie how important this relationship is and the importance of a high quality match. And ideally, registries can help support a strong match between a worker's experience and expertise and a consumer's individual needs and preferences. Registries may be a tool that supports family members as well. And I hope you picked up on that from Debbie too, is how important that connection of a direct care worker and consumer and family member working together, how important that is to a long-lasting placement and care relationship, and ultimately a situation that results in better, stronger care outcomes. At present, only 12 states offer registries despite their tremendous potential value. And our report highlights several recommendations around the creation, maintenance, and evaluation of registries. Throughout our report, you'll hear or see the need for additional information, and this is definitely an area which really warrants further exploration. We call on CMS to fund an evaluation of matching service registries. It's a follow-up on a 2023 bulletin, and we call on them to commission or fund an evaluation on a national level to be able to provide states with really crucial information to help inform their models. Issues like funding sustainability, design principles, the search criteria that's available within a matching service registry, such as geography, language, scheduling, expertise, care needs, as well as identifying the outcomes. How are registries contributing to positive care outcomes? We also see that the Department of Labor has an important role to play in terms of leveraging their key expertise and to expand the robustness of a matching service registry to include things like employment agreements and contracting guidelines. Matching service registries would benefit from the inclusion of a wide variety of expertise. And we call on states to convene wide stakeholder groups, including key state agencies like Department of Labor, Health and Human Services, Education, and also engaging long-term services and supports provider networks, community-based organizations, and most importantly, the end user, consumers, direct care workers, and family members or family caregivers. The goal then is to develop a product that provides connection to meaningful employment and increases access to care. And then we call on our state Medicaid programs to take that information and expand the use of evidence-informed registries going forward. Next slide. Our last bucket includes a set of recommendations to really help us build the evidence base in this space. One of the things that we found throughout our work over the last year was that we really need more information to support the policy recommendations, to refine the programs and services that direct care workers and family caregivers are currently receiving. And so we identify several areas where we feel there's a need for further investment in building a case for working with this particular care dyad. Most, throughout all of our recommendation areas, we highlight the need for additional evaluation interventions and demonstrations. And we further that in our final bucket here, really reiterating the need for us to understand the outcomes for consumers, for workers, and family members, so that we can really make an argument for deeper systemic investment and policy change in this area. There were additional areas that fell outside of the three recommendation areas that we felt warranted further investigation. The gray market is a large part of the long-term care services and support infrastructure, and yet our understanding of it is too limited. We call on the Secretaries of Labor and Health and Human Services to support a large-scale study of the gray market, and that such a study would help really expand our understanding of the long-term services and support system overall, and it could help us really think about what our efforts need to be within Medicaid and the regulated environment. One example of that is to understand how online platforms are being used to support care matches. Are those matches successful in the long term? What are the design principles that are being used in the gray market? And what can we learn to help inform the matching service registries that we hope will be developed by Medicaid programs? Additional areas outside the parameters of the report that could contribute to efforts to support direct care workers and family caregivers include care transitions. As you heard from Debbie, her son has moved into hospital, has been hospitalized. That's a pretty standard course for many individuals who are receiving long-term services and supports to have a care transition at some point into a more acute setting, perhaps then to a rehabilitation setting, to a nursing home, and then back home. You know, how are direct care workers and family caregivers working together to support those care transitions? What are the issues? You heard Debbie saying that some of the staff involved in her son's care had to take PTO in order to get through that time when their son was not at home. I want to back up for just a minute. I see a question about what the gray market is. That's a term for home care that is privately paid for and largely unregulated. I apologize for not defining that sooner. A couple other areas outside the parameters of this report is, and I believe Tony highlighted this, the use of caregiver assessments to help identify the needs of family caregivers and how additional supports could help support them further, including how direct care workers can provide perhaps training support, perhaps additional levels of support in supporting the caregivers the family caregivers in their roles. And we also see a role for direct care workers and family caregivers to work in closer partnership within institutional settings like nursing homes. Family councils are a place where there's a lot of opportunity for highlighting the need for better connection between staff, elevating issues that come up within institutions like that, and for direct care workers and family caregivers to work together on solutions. As we continue work in this space, you know, there's a lot of interest and exploration happening in technology solutions, along with, and that comes along with addressing issues around HIPAA, which is, you know, protected health information, how that gets shared, who that gets shared with, in the interest of really, you know, exchanging information about an individual in order to improve their care. There's a number of issues that come up around that, and who has access and for how long and all of those things. So we see tremendous opportunity for policymakers, providers, researchers, academics, philanthropy, and others to contribute to this space and to help really expand our body of knowledge. We feel like we're at the beginning of this work, and we look forward to working with a broad coalition of folks to really build this work out and really create the change that's needed to support this vital care partnership. That is the end of our recommendations highlights. And now we're going to move into a brief question and answer.
Great. So the first question we're going to start with is a question from Connie. So are family caregivers of all ages included, or only adult family caregivers? As you know, the majority of caregiving youth assist adults, many older ones. Connie, that's a really great question. Our recommendations had all caregivers in mind. With that said, we recognize that some of the existing programs are not inclusive of youth family caregivers. We know from Caregiving in the US, which is a report from NAC and AARP that approximately 5.4 million youth, so folks under the age of 18, provide care for parents, grandparents, or siblings with chronic medical conditions or functional decline. So we encourage policymakers to think about these youth caregivers as they design and implement policy.
And I see a couple of questions about matching service registries. One is, are there efforts to support the development of matching registries by nonprofit organizations? And yes, we do see nonprofit organizations partnering to develop matching service registries. I think one of the key questions that has to be addressed in a matching service registry is how you keep information updated. And a lot of the registries that we see have a mechanism for connecting to, say, the Medicaid, the state Medicaid program that is training direct care workers so that their training credentials are up to date. There's another question about how do matching services ensure that appropriate screening and background checks are completed. And that's another piece of information that has to be included, or I guess in the design of a matching service registry, it's a question about how that information, how and whether that information is included and how that gets updated. So I think there are a lot of opportunities within matching service registries to think broadly about what information gets included, who is the right and what's the right entity to run them, and how you keep that information up to date. So lots of questions. I think that's part of why we call for more evaluation work to really determine what the critical elements of a matching service registry are, and to address some of those systemic issues.
Great. So next we actually have a question for Debbie. Give me 1 second as I pull this up for you. So Meredith said she's interested in learning if Debbie has any strategies to strengthen the relationship with direct care professionals and the family. So Debbie, I wanted to give you the opportunity to respond to that.
Yes, thank you for that question. I wish I could give you like a black and white answer. I think it's a skill I've learned to develop over the years. I remember years ago when we first started this journey, we had some caregivers in our home who weren't very respectful, and they actually were speaking poorly about Joshua because of his disability. They didn't agree with the type of treatments that we were told to do for Joshua by his medical care team. And I just remember being really overwhelmed with this whole new life and having people in our home and people I didn't know. And I called my mom and I started to complain about how difficult this was. And she said to me something that was really difficult at the time, but she said, have you thought about perhaps what you can do to change that dynamic, which I thought was completely unfair. I thought, I want you to be on my side and not on their side or whatever, they're hurting my feelings. But it's actually taken a while for me to learn to step back, realize the commitment that people are making to care for Joshua, some of the challenges that they have in doing so. And then while we're here at home and comfortable in our home, they need to feel that way too. They need to feel respected, and their job is critical as ours. And so I think we've learned in establishing this kind of machine in our home that is what keeps Josh here, is just taking into account their expertise, their history, their experience, and just embracing them as part of the team. I think it's essential, however, to start out with a great foundation. For example, now we always do a meet and greet before we have someone even start the process of coming to apply to work with Josh, to make sure that it's a good fit. And then we also insist on at least a number of shifts of orientation with him, even if it's for anyone, for nurses, for direct support professionals, anyone who's going to care for him. We have them come and work a couple of shifts with one of the daytime nurses. And if they're going to be doing a night shift, to work a couple of shifts, first training in and then being shadowed by a night person, so that we can be confident that Josh is safe. And then the other thing is, we've dedicated ourselves to being always available in some way, to make certain that if they have questions or feeling not confident or whatever, that we're there. So yeah, it takes a machine and it takes a lot of time sometimes to learn this, but my mom was right. I can't just think about our side of it, but think about their side as well. And that was a difficult thing for me to learn. But also, I would say too, advocating for their competitive pay. The nurse who was coming on today, who's training in today, has been a nurse in home care. She's retired now for 30 years. Even though she's not accustomed to clients like Joshua, who are use technology, ventilator and have a trach and that kind of thing. I did advocate for her to receive competitive pay for her 30 years of experience in home care, and she was grateful for that. And so those kind of things, appreciating when people make extra commitments for Josh to live and thrive and community and participate in his community. So those who dedicate themselves and leave their homes to go on a short vacation with us so that Joshy can accompany us, and then compensating them for that sacrifice. So I guess I'm sorry, I wish it were just a black and white and cut and dry answer, but it's part of the journey and it takes a long time to learn. And I'm not sure if it can be put in a textbook. So thank you, Tony.
Of course. Thank you so much, Debbie. So there's one question I just wanted to address about the Caregiver Nation network. From Akisha, she said, what are some opportunities to become involved with the new Caregiving Nation network? So that's in reference to a new project launched by DAC. And the Caregiver Nation network unites caregiving leaders across 10 states in a shared mission to improve supports for family caregivers. We really think of ourselves as a toolbox to support some of the work that's happening on the ground. And the collaborative effort aims to cultivate and elevate state leaders, championing the needs of family caregivers, foster peer-to-peer learning opportunities, and elevate family caregiving issues on a state and national national policy agendas. We really think that cultivating state leadership leads to building a movement to change systems for the better to support family caregivers and those that they care for. And one of the issues that has really risen to the top in the work that we're doing is that intersection between family caregivers and direct care workers. So we think there's a great opportunity for knowledge sharing. Sharon, who is a part of our network, mentioned in the chat that New York State Caregiving and Respite Coalition is in conversation with Nebraska to duplicate their matching registry for their own use, specifically for respite providers. So I think that's just a key example of how state peer-to-peer learning can really help move forward efforts in this space. So if you are interested in getting involved, you can go to caregivernationnetwork.org. Again, caregivernationnetwork.org. You'll see the list of the 10 states that we're working with, but there's also an opportunity to join us by signing up for our newsletter to get more resources about what's happening at the state level. And I'd also mention that with Together in Care, we are working with an organization called Advancing States, which is doing great work at the state level, and we'll be presenting at the Home and Community-Based Services conference that's happening in Baltimore later this month. We'll be working on creating a dialogue with states about how to implement some of these recommendations and discuss some of the challenges that they're facing.
Great. We are coming to our last few minutes, and I wonder if we could go to the next slide. I want to recognize that we did not get to all of the questions here, so thank you for submitting them, and we will take those back. Your questions help inform our work going forward. We do have, speaking of our work going forward, we have a set of policy and advocacy efforts that we're going to embark upon over the course of the next 6 months, really stemming from the recommendations in this report. We see this as a starting point, and we, through the course of the next 6 months, as we take this out to broader audiences, we are seeking more folks to engage with us around this. We recognize that this report is, not the be all and end all. It's really a step out into this space, and we want to ensure that we are approaching this work as comprehensively as possible, that we are inclusive of all direct care workers and caregivers and the myriad of issues and opportunities that we can develop together. So you see the contact information for myself, Amy Robbins, and for Tony, as well as our organizational websites, and then the Together in Care microsite down at the bottom, where you can access the Together in Care issue brief. That's also where a recording of this webinar will be, probably not right away, but will be within the next few days. And we really welcome your outreach and your engagement. Please, there's a way to sign up for our newsletter on the microsite. Reach out to us and engage with us, because not to be cliche, but we are all together in care, and we welcome your partnership. So with that, it is 11 o'clock on the dot. I want to thank all of you for being part of the conversation today. We look forward to hearing from you, and we are really excited for the work ahead.